My name is Thembi Arries. I am a medical intuitive. I use alternative techniques to diagnose and treat illnesses. I've done this for over the years, and I've successfully diagnosed and treated people with the most complicated of illnesses, which have baffled even the best of some of the medical specialists.
Join us on their journey to better health and renewed hope. This is Dr. Alternative.
Welcome to Dr. Alternative. Welcome to Kabeja. One of these days we're going to say welcome to Gauteng. It's good to be back again. And today we are bringing you a topic that has been a request from so many ladies. And we decided we must cover it today. And the topic is endometriosis. Make sure you don't go away, and welcome to our show.
Hi viewers, warmly welcome back to Dr. Alternative Show. We are here again with another exciting topic, so please stay tuned for the questions and answers.
As you are now used to it, I've prepared this small clip to explain what endometriosis is. Please take a look.
Look at these babies. Very cute. Where did their lives begin? In the conception? Yes, although many would dispute that. There are many roles played by different parts of the reproductive system to finally have these beautiful creatures. One such part in a female is the uterus lining called endometrium. When all is well, this is where the baby grows. When things go bad and this lining grows outside the uterus, it is called endometriosis. This causes a lot of health problems for the woman, including severe menstrual pains, heavy bleeding, infertility, and many more.
As you can see on this clip, it's actually fascinating to see the complexity of the body systems and the complexity of the creation of life, of a human being. But as usual, we're going to be not just talking in general, but we're going to be discussing with Lorica and touching on some of the questions that you have sent to us, as this topic seems to be quite a burning one for particularly for young ladies.
Okay, thank you, Thembi. Doctors have seen this as a gynecological problem. What is your comment on that?
It is partly, I know it's regarded as you've got gynecological issues. Once you've got endometriosis, where do you go? You may go to your GP, but your GP is going to refer you to a gynecologist. I have yet to find a situation where you walk in with endometriosis and the doctor sends you to an endocrinologist, for instance, the doctor who specializes in the endocrine system. And yet, this condition is not limited to gynecology. It touches on so many other systems. It will fry your brain. It really will fry your brain. But it's limiting now. The approach of conventional, as I always say, is limiting the chances of nailing some of these conditions because they've got that blinkered approach.
Okay.
They look at, the blink through the blinkers, and everything else that falls outside your blinkers does not get a chance. And yet it is the very cause of you sitting with this profuse bleeding. So for me, yes, it is partly a gynecological problem, but it is an endocrinologist problem. It is a brain, neurosurgeon problem, and it is also a hepatic problem. That is, the doctors that specialize in dealing with the liver.
Okay.
And it's largely that than a gynecological problem. But when we go on with the discussions, I'm actually going to explain, or maybe I might just explain why I'm saying that. Now, if you look at endometriosis, as the clip shows, it is when the lining of the uterus, that the function of which is to thicken when the time for ovulation comes, because your body understands that when it's ovulation, it's time to prepare for pregnancy.
Yes.
So that's why the lining thickens. It's time, because that's what God has created, that for a woman to be able to produce, this is the process that must be followed by the body. So the lining will thicken, and it prepares to hold on to the egg that has been fertilized. Okay. But now, if that does not happen within the uterus, it's a problem, which is what endometriosis means. Because when that lining that is supposed to thicken and that is meant to sit in the uterus goes somewhere else, it thickens somewhere else. I mean, for all you know, I've treated a person who had it in the stomach, not at least when it is still within the reproductive system around fallopian tubes or ovaries, at least it is still within the reproductive. Once it goes outside the reproductive system, maybe the bladder or the stomach, that's even more mind-blowing. So when that therefore happens, that creates a problem of endometriosis, as the clip is saying. But then, when where you find that the problem occurs is that the liver is so squarely involved in creating that type of a problem. Not just necessarily endometriosis, but also estrogen dominance. Because remember, endometriosis it's an estrogen problem. Okay, when estrogen being the hormone that manages your reproductive system, that you get your menstrual cycle, if you've got a fertilized egg, it's going to be implanted on the endometrium, If it's not fertilized, then you're going to shed it, that endometrium, and it comes as menstruation. That's estrogen. Estrogen that is managing that whole process. But estrogen is so very much part of the liver processes. Okay, so where does that come into play? The liver is very much involved in hormonal balancing. And people that have come to me either with heavy bleeding or cramps or infertility or whatever, you will find that most of them actually link their problem to the liver. Now, estrogen is a hormone, but it's produced in the ovaries. Okay, part of it is also, you will find it on fat tissues as well, and some in the adrenal glands that are in the kidneys, top part of the kidneys. But the big percentage of it is produced in the ovaries. But when it has not achieved the function of it, which is to manage your menstrual cycle, maybe you don't fall pregnant and all that has got to be shed and what have you. It is the liver that is processing the metabolism of that estrogen to make sure that excess of it is released. It's the liver. It's not your uterus that's managing that process. It's the liver that's making sure that estrogen is metabolized, excess of it is eliminated, and that's the function of the liver. But also that estrogen, now remember, it's the liver that's metabolizing it and making sure excess is eliminated. But then estrogen, on the other hand, is assisting in bile production. Bile is the function of the liver, and bile is used to metabolize fats, fat accumulation and all that. That's the liver function. But it's estrogen that's assisting that liver to do that. So can you see that you can't separate one from the other? They are coexisting. They are reciprocal. Okay, this one is helping this, and this one is helping that. So therefore, that is why you will find that most problems that involve infertility and heavy menstruation or cramps or whatever, the liver is never looked at. But the focus is on its gynecology, it's your uterus, meanwhile, there's the liver's causing the whole havoc. Why would it cause the whole havoc? That when the liver is not in a good state to manage excess estrogen, then you're going to sit with estrogen dominance, which on the other hand also causes you to have menstrual cramps, excessive bleeding. You might have issues. That is why you find people that they say, when I go on menstruation, I will have an outbreak. Acne will just, I'll feel nauseous. And that's not the uterus, that's the liver. That is the liver. And you'll find others will say, I tend to, and you'll find that in most cases when girls reach puberty, which is the age during which that their cycle is kicking in, they develop the body. You find they were tiny, weeny, but when they reach that, then you find they actually start to get fat. Because estrogen is linked to fat processing, which is function of the liver, is part of this whole thing. Then you find you develop fat because even estrogen, there's also a little bit of it that gets produced in the fat tissues. So it's also linked. So how then can you think you will fix the problem of a person who's menstruating like crazy, who's bleeding profusely, and who's having all these nauseas and this, and you think it's just a uterine problem, it's a reproductive system problem. So that is why I'm therefore saying, yes, it is partly a gynecological problem, but your hepatic specialist, who works with your liver and is squarely part of that. So is your neuro, who works with your pituitary gland, because your pituitary is also part of this whole process, because it produces the prolactin hormone, which also works hand in hand with estrogen. But I won't get into that because we will end up diverting, quite a lot. But so what I'm saying is, you cannot look at endometriosis and think it's just limited to gynecology. You look at particularly the liver. Particularly the liver. You can't separate the problem of endometriosis from your liver. So, but there's so much to talk about that. But because we guided by I will just leave it at that so far.
Okay, thank you very much. Our belief and what doctors say is that heavy flows mean endometriosis. Is that a correct assumption?
No, it doesn't always mean that. Now remember, endometriosis and estrogen dominance. Those are two different things. Endometriosis is still an estrogen problem, but when you've got endometriosis, as I've indicated, it's got to do with the lining growing somewhere else and causing havoc. But when you've got the estrogen dominance, that means you are not eliminating the estrogen well enough, but you will find that it gives the same symptoms.
Okay.
You will bleed profusely, you will have cramps, you may have nausea, the estrogen dominance and endometriosis, they tend to be very similar in their manifestations in terms of symptoms, even though they are two different things. So which you cannot treat, because remember, we're talking endometriosis, we're talking about if I may make an example of a seed, that a seed of millet that's supposed to be planted in this row, but because it has fallen off while you were going to the field to plow it, then you find it there maybe by the toilet. Those toilets in the rural areas that are outside. You find it there. It does not belong there. It's a mess there. It shouldn't be there. This is where it's supposed to be. So it's lost there. It's gonna choke. So endometriosis is, if you can just think about something like that, that's supposed to be here, but then it just goes and grows somewhere else. That's the problem. Whereas estrogen dominance is when the estrogen, you're sitting with too much estrogen, too much of that hormone. It shouldn't be too much, and it shouldn't be too low. You must just have the normal levels of estrogen. But the liver is very big on that, because it is the police that must make sure it eliminates, But because you're bleeding profusely, they say, endometriosis. So that's the dilemma that gynecologists are facing, because this thing is dumped on them. And they also focus on what they've specialized in. So it's this. So endometriosis means endometriosis doesn't mean heavy bleeding, because that's the misunderstanding, that when you've got endometriosis, first thing that comes to mind is, you bleed profusely. It doesn't mean that. It means the lining, the uterine lining, the endometrium that's just growing somewhere else, which then will lead to heavy bleeding. But also estrogen dominance, high level of estrogen, will cause heavy bleeding. But then you'll find that tends to not be the diagnosis. They will just say, you have serious heavy bleeding. bleed in between, not even following the cycle. And then you've got endometriosis. So they don't separate, and yet those are two different things, even though they may yield symptoms that are similar. But we're talking two different things altogether, okay? Which you may find that the liver is very much involved in both estrogen dominance and endometriosis. But anyway, to answer your question, it's not the same thing. We're talking about two different things. Doesn't mean when you've got heavy bleeds with cramps, with what, then automatically it's endometriosis. It may very well be estrogen dominance.
Oh, okay. For me to just chip in, I have a question to ask. Like, for example, this family planning, like the 3 months injection. Most of us that have been on that injection complain that it makes us to overflow. So does that mean it is a problem on the endometriosis? Yeah. Or is it just the family planning itself?
No, but family planning, what is family planning? Family planning is tampers with your hormones.
Yeah, it's true.
That's what family planning is. It confuses your hormonal system, it confuses your brain, it changes things from this to that.
Yeah, therefore the cycle will...
Yeah, it messes, even though in most cases you find people that have got issues of heavy bleeding and cycles that are out of, tune, they will give you contraceptives to try and regulate it in a way where they say, once the pill reaches these 4 red, then you're going to menstruate. So which is a fictitious way of, that's why it throws people out of total fertility. Because you'll find people that are using contraceptives, the majority, they become very infertile, okay? Because it tampers with the natural processes, okay? Because all this is predetermined. Just like I usually say that for the heart to pump, it pumps at this rate. Even with the cycle, menstrual cycle, no, there's no one who just decided it must be 28 days or it must be, it's God who says, okay, this is the cycle. This is how I want it to be. And within this cycle, this is when you ovulate. When you ovulate, this is what should happen. Because the whole purpose of having the cycle, menstrual cycle and ovulation and all that, is for pregnancy.
Yes,
that's why God created it. It's for procreation. It's not nothing else. But because people want to engage in sexual activity without falling pregnant, therefore they had to now tamper with that process. And in the process, they throw everything totally topsy-turvy. Okay. But if you look at why did God create a menstrual cycle? For procreation. Nothing else. Why must you have ovulation? Which means you're releasing the egg that is ripe enough to be fertilized so that you make a baby when that egg is fertilized. So, and where must that egg be implanted when it's fertilized? It must go and sit in that lining, that uterine lining, that endometrium. That's where it's supposed to sit. But when there is no fertilization that has occurred, then that thing must fall away. It will prepare for the next month again.
Yeah.
So that period is not a man-made period. Nothing in the body is man-made. Nothing. I promise you. This is the thing that I keep telling us. Nobody has created the body. The body has been created by God, and every system, He has mapped out how each system should work with time frames and when it must, because even the cell must be produced at a certain time, it must be used, and it must die because the next one is going to come. Same with your reproductive system. It's no different. The egg must be produced within a certain period, must be fertilized. If it's not fertilized, it must be shed. So now, to try and tamper with that process. So what happens? We come with all these injections. Some, they will dry up the endometrium so that you never get to have, even if the egg is fertilized, it cannot be implanted anywhere. Because if there's no lining, there's no endometrium that has prepared itself for that because it has dried up. So even if it's fertilized, it's going to go shh, because there's no place for it to sit. So what I'm saying, therefore, is that these different types of contraceptives are actually messing up big time to kind of cause infertility. So then you find a person after so many years wants to fall pregnant. They cannot, because that endometrium is buggered. It's been dried up for a long time. That's why some of these injections were banned in some of the countries. I don't know if they're still used here, like the Tepo.
They're still using.
Yeah. So, but that's the situation. Let's go for a break. When we come back, we discuss this further.
If you are fructose intolerant, you should not eat fruit. Otherwise, it will harm your health extensively. This is a genetic disorder directly connected to adenylase enzyme deficiency. Diseases including tissue cancer.
My name is Rachel. I am 35. Well, I was diagnosed with GIST, which is gastrointestinal stromal tumours. It's really rare. It's a form of sarcoma. It starts in like the connective tissues, and for me that was the lining of my stomach.
Liver disorders and mental disorders. How do you know if you are fructose intolerant? And even better, what food you must eat?
Welcome back. We are talking about endometriosis and other related discussions around the reproductive system of females. So when we went to a break, I was talking about adverse effects of contraceptives on female fertility. But maybe before you continue with your questions, maybe the question might be, then what are people supposed to do? Because you don't want to sit with all these children and you can't afford to look after them, or you can't cater for them and all that. So if these contraceptives are causing so much havoc, then what options have people got to kind of deal with the situation?
Okay, like for example, women, they get closed after a number of children they already have. But then, at the same time, there's still a 1% chance that they can still
they might still conceive.
So
Yeah.
it's really...
Yeah. It's, well, I suppose, just like I've said earlier, that the purpose of having menstrual cycle and all that reproductive system is for procreation. That's why you find it stops at a certain age. You find people reach menopause, they're no longer menstruating because they don't have to have children at that age. The body cannot cater for that, and God has predetermined that once you reach a certain age, then you are not good enough to still be carrying children. That's nature.
Yes.
That's nature. So now, what do you do when, like going back to, what do you do when you cannot have all these children, but you're still of childbearing age? What do you do? What do you do? ask.
You go on those family planning because you don't want to sit with all these children. They are expensive.
No, but this is actually taking us back to God's creation. I mean, people say for Catholics, Catholics are known for what? For having large families. You find those old Catholics. I'm not talking about these modern Catholics. I'm talking about the real Catholics of olden days. They used to have, I know that at my home, in my family, we were 9 children. Of course, 3 passed, but we were 6. Family, they would have 13 children. They would have,
It's true.
because there is nothing like contraception that is allowed by the church. But because it's it's working against God's natural laws.
Yeah.
But there is the natural contraception that the Catholic Church introduced, which means you abstain from sexual activity when you are ovulating, where you are at the peak of your cycle. So you abstain, then you can, that's the only way you can avoid falling pregnant, because then the egg will shed off because it has not been fertilized.
Okay.
But then what does that mean? It means a discipline. It means discipline. Just like I'm not preaching, viewers, I'm not preaching. But I'm just stating that all these things, they're so interrelated. That the discipline of being able to control the body applies even in this case of reproductive system, where you can determine how many children you can have by abstaining. All you do is just abstain during the period when you are at your peak, and then you're not going to fall pregnant. And there's no way you will fall pregnant. So that's abstinence. That's fasting. In other words, you fast from sex, not from food.
Okay.
That's fasting, which is in itself a very healthy state of being. So then you are working in tandem, with God's natural laws. You're not working against. And then you're not going to have 13 children. You will still have the number that you want, but you are abstaining when it's time for when you are at your peak. So that's it. Otherwise, this chaos that's happening, it's happening. It's going to continue happening because anyway.
Yeah. Thembi, can you give us an example of cases you have treated with this problem?
Yeah. I've got quite a few people. Most of the people that come to me are not people who are sitting with just the bleeding problem. Most of them, they're coming because they cannot conceive. But bleeding is part of the problem. Okay. And the majority, like I've said earlier, the majority of them, it has been the liver that has been the culprit, and also the multiple endocrine neoplasia. Okay, I'll come back to that one. But the liver is the largest culprit in causing issues of endometriosis and infertility and, heavy bleeding and whatever. Now, I remember, I'm just thinking about now, my granddaughter. My granddaughter gets seriously heavy flows, and she gets, nauseous, and she, So, and I gave her the treatment that would take away all that, which worked very well. And she was also, chubby. So I started treating, and I gave I started treating the liver, flushing the liver, and I gave her some treatment for estrogen, to eliminate estrogen. And she said it worked so well that she would even forget about her cycle, because whatever would remind her about the cycle would be the pains. But now, because there are no pains, she would forget that, it's my cycle, you know. So that's how well it was. And I mean, this estrogen, flushing of estrogen works. But then you've got to know where you take it from. Okay. So, but even coming to other cases, I mean, like I've said earlier, that people who are having problems of endometriosis or even estrogen dominance who come to me are not coming to me because of the serious heavy flows and cramps. People tend to accept that when you are a female, this is what you go through. And they just sit with pain management, and, you know, because it's only a few days and then until the next cycle comes. But those that come to me are people with infertility issues. And I think the one that I can select from the list is this lady. She had a antiphospholipid. She was bleeding. She was bleeding profusely, and she was battling to fall pregnant. And they had told her that it was not just endometriosis, but they said she has got fibroids.
Yes, I was thinking.
Yeah, they said she's got fibroids that were blocking the tubes and also the space, the endometrium itself. So she was not coming, but with her, it was more for fertility, because she wanted the baby very, very desperately. So she comes, and I picked up, firstly, she was fructose intolerant, okay? But the fructose intolerance had caused her to have antiphospholipid syndrome, okay? Now, antiphospholipid syndrome is when your clotting factor, because remember, the liver produces a protein which is called clotting factor, which manages the texture of the blood. That must not be too thick, it must not be fluid enough. I mean, too fluid. So it just maintains it on the appropriate balance. So, but when you've got APS, antiphospholipid syndrome, then it messes up that clotting factor. Therefore, the regulation of the texture of the blood is thrown totally out. So she was therefore having that. But then you'll find that people with antiphospholipid syndrome, they don't just bleed profusely, but if they are lucky enough to conceive, they miscarry. They without fail, they miscarry. In her case, she had not conceived and miscarried, but most people that I've treated with antiphospholipid syndrome, you find they miscarry one after the other because of that bleeding problem. But also, so that was the situation, the cramps that were heavy. But also people with antiphospholipid syndrome, you'll find they will not just only have issues of bleeding, they also have issues of clotting. You will find that because of that clotting factor being a problem, in some areas you find they've got thick blood, while with the bleeding, they're bleeding profusely. But then they will tell you that when they bleed, they bleed lots of clots. Okay, so this one was antiphospholipid syndrome, even though she had come with a diagnosis of endometriosis. Okay, so I treated her. She was, like I said, that it was fructose intolerance, totally stopped her from taking fruit. Treated that liver. There was no growth. There was no there were no fibroids. So I worked on that liver. The focus was really on that liver. Sorted out even got rid of antiphospholipid syndrome. Because antiphospholipid syndrome is an autoimmune disorder. So where the immune system just goes crazy and then damages clotting factors. So there are protocols for autoimmune disorders as well. So I worked on that totally. And then guess what? She conceived. Yeah, she conceived, and she was so excited with the conception. But then I continued because I said, okay, you must go to your gynecologist because I cannot do what they do, these antenatal care, processes. So she went to gynecologist, but then I said, take me all the way, walk the journey with me. Whatever she's recommending that you must take, even in the case of supplements. I actually told her what supplements she might take. Okay. Because the ones that you find, they are your regular supplements that they give to every person that's pregnant. It doesn't mean it's good enough for everybody. It was not sufficient for her, Okay. So I had to beef up, her supplements, and I guided her what she must actually take on the supplements. And everything was going very, very smoothly. Until one day she calls me, she says, the pain on the abdominal area is excruciating. I cannot even walk. I walk like a duck, which is why you find some of the people that are pregnant. Have you seen that they will walk? They walk like that because it's the pain.
Yeah.
She said, I can't even go to work. The pain is excruciating. And this gynecologist told me that it is because of the weight of the baby.
Yeah, so pressure.
Yeah, you just have to deal with it. And as the baby grows, the pain is going to be more. She said, I cannot survive this kind of pain.
So it was a big baby.
It was So then she said, please help. Please help. Then I said, okay, because I knew that she was a long-standing problem of antiphospholipid syndrome. I knew that means endometrium, not endometrium, endothelium. That's something else. Okay. Now the endothelium is the membrane inside the blood vessels, which controls the contraction and relaxation of the blood, as it's pumped within the vessels. So that endothelium has got to be elastic enough to do its function. But for people who have got antiphospholipid syndrome, who you find they've been sitting with the issues of blood that's like running head topsy-turvy, then you find that endothelium ends up getting affected. So in her case, I could just put 1 and 1, even though I did not scan her at that time. I just put 1 and 1 that it definitely must be endothelium. Okay, so I sent her the medication for correcting the endothelial dysfunction. And she said, within a day, the pain was gone.
Wow.
She even said, she changed the gynecologist, because she said, for her to tell me that I was going to sit with that kind of pain and I must endure it up until delivery. And yet she was talking nonsense. So she changed, she moved, she went to a male, gynecology. I don't know if it makes a difference if it's a male or a female, because if she doesn't know, she doesn't know. May even be him. If he doesn't know, he doesn't know. But the advantage was that she was with me and I was doing my part while the gynecologist was doing her part. So that was one case. Like I'm saying, that most people who come to me with endometriosis diagnosis, it's not really that, it's the liver in most cases, and because of infertility. So I've got lots of grandchildren that, seriously, I've got lots of, if I would be allowed, I was just gonna brag and show, because the mothers, they send me their pictures, and I've got lots of grandchildren whose mothers I've assisted to conceive while they came with help me, not only with infertility, but with this endometriosis.
Wow. Okay. There's a belief that if you have severe bleeding, this gets corrected with your first pregnancy. Is this an telltales.
The Makulu wisdom. Is that the Makulu wisdom? I mean, there's a lot of wisdom in even if they cannot give a scientific explanation to say why it happens like that. You will find most people, when they start, when they fall pregnant, they actually tend to have that. But the scientific explanation for that would be there is a hormone that is produced by the pituitary gland, which is called prolactin.
Okay.
Now, prolactin manages the pregnancy. Once you are pregnant, you have to have breast milk. There are certain hormones that are changing. Then so all the processes that go hand in hand with pregnancy, it's the prolactin that takes over. But then the prolactin keeps the estrogen in check. So that is why, therefore, you will find, because remember, it's the estrogen that's throwing your menstruation and bleeding and all topsy-turvy, because when you've got estrogen dominance, then you have those issues. But now, once you fall pregnant, then the prolactin takes over. And the prolactin keeps the estrogen levels in check. Okay. So which are the ones that are causing you to bleed profusely and to have menstruation, pains and whatever. So now, because it's no longer dominating the estrogen, the prolactin has taken over. So that is why, even though the wisdom of the Makulus cannot explain scientifically why, but it is the truth that you will, when you get your first pregnancy, start having a relief, because that prolactin has a kind of stabilized and is watching this estrogen. But then if your liver, though, that will happen within a certain period. But if you don't fix your liver, if it is the liver that's causing those issues, or even other things like your endocrine system, your pituitary gland, which is the one that's responsible for producing prolactin. But if you don't fix your liver, you will find you may very well have issues of pains again, even though it will not be with the same intensity as before you had your first baby. So there is wisdom in the Makulu stories. There is a lot of wisdom there. So that's where the scientific explanation actually comes in. It's that prolactin that tells the estrogen to, like, hey, stop your nonsense. This is where we want you to remain at. Therefore, that's not going to disturb your situation. But in any case, when you're pregnant, you're not menstruating anyway. Okay.
No, but there are some women that throughout their 9 months of pregnancy they will
still menstruate. Okay. And you'll find that some of those, firstly, you'll find it's people that have got it's not normal. It shouldn't be. You shouldn't bleed when you are pregnant. And those people that, most of them that are actually bleeding while they are pregnant, it's people with antiphospholipid syndrome. Okay. So, which is why I said that most of them, you'll find they will actually miscarry, okay, because of that antiphospholipid syndrome. But some, they will stagger up until they reach but then you'll find, even though they bleed, it's not heavy. It's not heavy bleeding. It's
drops.
Yeah, it's just drops. So, but if it would be heavy bleeding, you would really definitely miscarry. Okay.
There's danger.
So that it's people with antiphospholipid syndrome are the ones that you find they tend to have that. But naturally, you're not supposed to bleed when you are pregnant. Yeah. Anyway, I think that is where we're going to end our show today. I hope this has answered particularly those people who asked us to cover this topic. But if you still have some other questions, you must feel free to write to us or to send us a request so that we cover the show. Beyond that, you can just make a booking, and then I can see why are you having this problem. But thank you for those questions, and thank you for watching, and goodbye.
Thank you, viewers, for tuning in on the Dr. Alternative Show. Till next time. Thank you.
In the next episode of Dr. Alternative Show, we discuss the respiratory problems.
What would you describe as a respiratory problem?
Don't miss it.